Welcome to the Listen Up podcast, where we explore hearing loss, communication, connections, and health.
Hi, Dr. Mark Sims. I'm the host of Listen Up podcast, where I feature top leaders in healthcare. This episode is brought to you by Arizona Hearing Center. I help patients to effectively treat their hearing loss so they can connect better with their family and friends and remain independent. The reason I'm so passionate about helping patients is because I lost my brother Robbie twice. First, from his hearing loss, from radiation to his brain tumor, and then again when he passed away. I only care for ears. I'm the ear of ENT who has performed over 10,000 ear surgeries over the past 20 years. I'm the founder of Arizona Hearing Center. I'm the author of Listen Up, the book Listen Up. Go to listenuphearing.com. Also, if you want to look at my practice and contact us, go to www.azhear.com and contact us with any questions or things you wish us to address. Today, we have Tamara Lieberman. She's an awesome internist in Phoenix. She practiced internal medicine at the Practice Internal Medicine of Arizona. She went to University of Arizona for undergraduate and medical school. She completed her residency in internal medicine at St. Luke's Roosevelt Hospital of Columbia University College of Physicians and Surgeons. She returned to Arizona to start practicing medicine in Phoenix, and she's been named a top doc by Phoenix Magazine every year since 2016. I'm excited to have her here today. Dr. Lieberman, welcome to Listen Up, and thanks for coming on. This is great. Tell me a little bit about your medical journey, Dr. Lieberman.
My parents are not medical at all. So my mom is actually a teacher of the deaf, and my dad is an accountant. And there was no kind of medical background in my family. So my parents' friends, I had, there was, friends of the family that were doctors, but it really, I really kind of came to it, like I said, I think from a love of anatomy.
Great. And so when did that time come where you said, okay, this is for me?
It really started in high school. I pretty much in high school started saying that I was going to go to medical school. And then, from the beginning of college, I basically, went in knowing I was pre-med. I actually also have always had an interest in the arts. So I was always into theater and singing and music. And so I remember my freshman year of college at U of A, I went to the guidance counselor and I said, okay, I want to major in pre-med and musical theater. And he said, well, you're going to be here for 7 years because they're both pre-professional majors. And so it was that moment that I just said, okay, I'm all in. So I decided it was medical school for me. And I majored in MCB, molecular and cellular bio. And every single semester, I took a dance, music, drama, some sort of class that was related to what I really enjoyed as a pastime. And then, just went straight through to med school.
Do you still pursue musical theater and stuff now?
No. I like to go watch musical theater. We were really excited when Hamilton came out on Disney Plus. In fact, one of the trips that I had canceled last year due to the pandemic was a New York City trip over Labor Day with my 9-year-old daughter. We were going to go see Hamilton. And of course, that all fell apart. I think, I have 3 children. My youngest is 3. And I think that maybe once they're a little bit bigger, I would love to pursue that a little bit more.
No,
I do still play guitar and sing, but in terms of being on stage in like some sort of production, I have not done that in a long time.
You're on stage every day with your patients.
Well, it's good practice.
That's great. And Hamilton's an amazing show. I have to say that the whole thing that it's sung, it's absolutely
amazing. My daughter knows it all by heart. Yes. It's pretty impressive. Yeah.
My youngest is 14. She her bucket list is to meet Lin-Manuel Miranda.
Oh.
She could meet anybody that would be who she would want to meet out of.
He's unbelievable. I saw In the Heights when it opened on Broadway when I was in New York City doing residency, and it was unbelievable.
Well, the movie's coming out this summer.
I heard. We're very excited about that. Yes.
Right. So that's great. Yeah. He's a very talented person. That's for sure. So tell me about, one of your best patient moments. We all have those times where patients, they have a profound, every day is a privilege, but there are those ones that sometimes, really transform you or give you that memory.
I there's lots of those. One of the ones that's kind of coming to me and stands out for me is I do a lot of just annual preventative physicals. And people ask me a lot of times during my annual preventative physicals, what are you looking for? Have you ever found some sort of abnormality? And I think the ones that are really, really interested, the ones that kind of stand out to me are the ones where I actually do kind of find something that makes a really big difference in someone's life. So one of my patients that I've been seeing for years, and her husband's actually a physician, her children see me, which is really fun also, kind of seeing the whole family. So I knew her pretty well. Doing her annual physical one year, and I heard a new cardiac murmur and referred her over for evaluation. And it ended up being a really significant new, valve abnormality. And she ended up needing kind of emergent surgery. And she has just been, just unbelievably grateful to this day. Every time she introduces me in the community and every time she comes in, it's, this is the doctor that saved my life. And so that's always fun, it's always fun to kind of find something like that just in your regular practice, and kind of know that you are making a difference. So,
well, I think part of it's also what's regular to us is not regular to them, right?
Right.
So, it does make and that's why I think, when you talk to our colleagues, that's why we all went into medicine, I would hope, is
Right.
to make a difference in people's lives in whatever way that we do. So well, tell me, you work for internal medicine, or at Internal Medicine of Arizona. Tell me how you ended up there, or what was your pathway to that?
So I did residency in New York City and thought about staying there. I absolutely adored New York City. It's hard to practice in New York City. There's kind of a glut of physicians there,
and then glut of people dating out of residence.
Everyone wants to stay in practice in New York City, and as an internist, there's a lot of competition, and honestly, job satisfaction isn't wonderful. You're still doing, hospital and office work as a primary care doctor. And, for a few different reasons, I interviewed for some positions out there, but for a few different reasons, I decided to come back to Phoenix. And not having done residency or, med school, I did my last 2 years of med school at U of A, and I did do some rotations in Phoenix, but I really had not much of a connection to Phoenix. So it was a little tough kind of figuring out how to apply for jobs coming from New York City and Phoenix. I didn't know anybody. So I actually, at the time, I'm pretty sure I looked at a phone book. I feel like I'm pretty old in that way, and looked up physicians, practicing internal medicine physicians in Phoenix. And I literally sent out cold resume and cover letter and pictures and said, hey, are you interested? And then I also did a few other things. I think I contacted a recruiter. I think I contacted a hospital system. Those didn't really lead me anywhere. But the cold resume and cover letter led me to a very established practice. It was the only response I got from Mort Dubnow. I don't know if you know Mort Dubnow. He practiced as an internist in the Valley for 50 years. He's actually still practicing. Very, distinguished and experienced physician in Central Phoenix. And he liked on my resume where I put at the very bottom that I played guitar, going full circle back to that, because he had at 70, I believe, picked up classical guitar and was taking lessons. So he just was fascinated by that, of course, right? So I came out, interviewed with him and his practice, and loved it, and ended up, starting with his practice. It was called Medical Specialists on 3rd Street in Palm Lane. But that was in 2007. So right at kind of, right where the first world was ending situation was happening. So a year after I started at that practice, I think even less, we had to close our doors. They actually went bankrupt. He had invested in an executive physical program. It was just kind of a bad time to invest in a new business model. And so the whole practice closed its doors. So at that point, I called another prominent Central Phoenix physician who I had interviewed with on the trail when I had contacted Banner. So Bruce Bethencourt, and Bruce Bethencourt was just in the process of converting his practice to a Banner practice.
Mhm.
And so I joined that practice for 3 years, became very disenchanted with corporate medicine, if you will. And so after I had my first baby in 2011, contacted Wayne Cool, who's the owner of Internal Medicine of Arizona. It's a kind of a rare entity for internists in these days that he still owns his own internal medicine practice. We're not owned by some sort of corporation that's passing down rules on what we can and can't do. So joined his practice in 2011 and never looked back. It's been amazing. It's grown tremendously since I joined. When I joined, there was 3 physicians, one of which had come from medical specialists when it closed. So I knew him, and yeah, we had 4 docs in the office. When I went on maternity leave with my second, they realized they needed more help. So it's just grown since then.
That's
So,
awesome.
but it's been great. Yeah, we've moved 3 times because we've grown so tremendously, and it's been a wonderful place to practice internal
Well,
medicine. Kind of
what,
old
what
fashioned.
what makes it different? Like for you professionally, how is it different?
I mean, the whole atmosphere. So, in this practice, we have, well, okay, compared to corporate medicine, we didn't have our own offices. So you think when you go to a doctor's office, you think that they're going to have a nice office with their diplomas hanging on the walls, um you come in and you sit at a desk and you speak to the physician, and then you get up and move to a different office to change and do the exam. That's how, when I was a kid, that's what medicine was like. So in corporate medicine, there's no doctors don't have offices.
I mean,
There's
providers.
exactly providers, right? We're not called physicians or doctors anymore. We're relegated to, right, a provider. We're employed, and it's very obvious that we're employed. And every office, every exam room is the same, and they're very sterile, and you're expected to see a certain amount of patients per hour in order to maintain productivity and in order to make your RVUs. And that's none of that happens in a private practice that's, kind of in a model of yesteryear, if you will. With a physician owner, we have our own offices. Patients come in, they sit at the desk, just like, when I was a kid. And you establish these great relationships with these people. I don't feel rushed through my day. I'm still seeing, maybe 15 patients max in a day, as opposed to in a corporate medicine setting, you're really kind of pushed more and more, 20 patients a day, 25 patients a day, like just in and out. I'm not able to establish the relationships, the rapport that I can, in my private practice setting. So I really like that. I've always liked kind of the rapport with patients in terms of internal medicine. I mean, that's kind of a big part of what led me to that career.
Sure, the care,
Right,
not the medical care, the care, right?
right,
That's
right.
different.
Yes.
Yeah, that's great. I I was looking at the website before. You've got a lot of physicians there. How many work there now?
Okay, so we just hired a new nurse practitioner. Um, I think
It's
there
like
are
half a dozen or something like that.
9 now. No,
Wow,
yeah, there was so 4, 5, 6. There's the 8 or 9.
great.
And
That's
Wayne is still there. Wayne is still practicing. Wayne Cool, the owner of the practice, he's kind of in a more concierge model at this point, but he's still around. He's still in and out. And so we've got a nurse practitioner, a PA, and then the rest are physicians.
that's
So there's a
great.
bunch of us. Yeah,
Awesome. That's great. And it also, maintains your satisfaction as a physician and to practice in a environment that
100%.
you really enjoy. And that's what I think is
100%.
important, right? For
Right.
longevity, that's for sure. And so
Yep.
in terms of internal medicine, it's a pretty darn big field. Like what are the parts that you enjoy the most? Not that you won't do the others, but what are the parts you enjoy?
So I think, again, going back to that actual patient relationship, seeing patients across generations. I mean, I have so many families. I see, daughter, mom, grandma in the same family. Well, and of course, sons, husbands, and grandpas as well. My practice is primarily women, but I definitely see my guys as well. But I like that. I like that I kind of get to know an entire family and, kind of follow them over the years. I mean, I have patients now. I started practicing in 2007, and I have patients now, that I've been seeing for 13, 14 years. So that's really fun for me to kind of see the progression of them in their lives, of course, also medically, but I really like that long-term relationship with the patients. I think that's really special to me.
That's great. Yeah. I mean, and so, that what you're taking care of is it's the whole patient, I assume, in terms of that
Right.
kind of holistic type of approach. Is that
I
right?
do, right. I do like being kind of my patients call me the quarterback. So, they come to me with all of their issues, and maybe they're seeing multiple specialists, or maybe I need to refer them to different specialists. But I'm the one that kind of takes everything and organizes it. I'm very organized. I'm very organizational oriented. I like the organization. I look at all of their medicines and make sure that they all go well together, and make sure that the cardiologist that added this medicine, that the medicine that was added by the kidney doctor at the same time actually go well together. And so I like being the quarterback. I like kind of starting from a preventative, aspect. And then, if I need to refer patients out, if things, if there's other issues, I like, kind of being the one who picks who they go see and when they go see. I like kind of, that role of being the leader, the quarterback,
Or captain of the ship, right?
captain of the ship. Exactly.
Yeah, I mean, I'm an ear doctor, but I know polypharmacy where people take medicines is a big problem. So actually, in my own practice, I've moved away from prescribing long-term medicines. I'll say, look, I'm going to prescribe it to you for 2 months, and you're going to transition this to your primary care because the captain of the ship or the quarterback needs to know what
Right.
what you're on. And so
Right.
I'm just the ear guy, but I've kind of figured out that, when the literature is pretty supportive, that you need somebody who's putting it all together. And
Right.
that's great that you're doing that.
Right.
So,
Yeah.
well, as you know, I'm an ear doctor. And actually, it was interesting. One of the things you said was your mother was a teacher of the deaf, right? So I assume to some extent you have some awareness of hearing loss and the effect.
So my mother is actually deaf in one ear and hard of hearing in the other. She went deaf in one ear after apparently as a child being infected with measles and then mumps. So my whole life, it's been, I've been absolutely aware of that. She went into obviously teaching the deaf because of that, and as a kid, I had a lot of contact with deaf educators. So there was a lot of sign language in my house. I mean, my mom from across the room, if I was too far to yell at, she would try to sign to me. I never actually picked it up, but so I've been definitely aware of hearing issues my entire life, actually.
That's great. Yeah. Well, as you know, that's fine. Do you have patients with hearing loss?
Oh, absolutely. Absolutely.
And
I
so,
absolutely do. I find myself, I try to be, I think because of my experience with my mother, and I think, because her hearing loss occurred so young, she's not like a patient who was able to hear her entire life and then lost their hearing, where they feel a little bit meek. And if they can't hear you, they don't necessarily speak up. My mother has always spoken up. If she can't hear you, say it again. And she's not afraid to ask for it multiple times. So I think that experience has allowed me to be a little bit more understanding of my patients. And if I even catch a hint that they're not understanding me, my volume goes up. So I really try to be cognizant of that. But absolutely, lots of hard of hearing patients.
yeah, I mean, I've seen a ton of patients because of the masks, right? That we're all wearing masks
Oh,
still in office. And so the lip reading goes away. And then all of a sudden, I was talking to an ENT colleague of mine who was wearing hearing aids for the first time. He goes, yeah, I've had a hearing loss, but now the masks, I just can't keep up.
no, absolutely. Absolutely. It's been a real struggle. I mean, there have been times where I've actually had to pull down my mask just so they can understand briefly what I'm saying before I put it back up. I mean, it's definitely an issue.
Yeah. Well, I mean, obviously, it's very topical now. How has COVID affected your practice?
So, not much actually. I've been in the office the entire time. We never took a break. My office, in addition to being kind of different from corporate medicine in the ways that I've already described, we also don't have any sort of electronic medical record system. So we're all paper charts, which is very kind of old fashioned in the medical world, which I actually love. But because of, I think, the resistance in general to technology, even with the COVID pandemic, we do telemedicine visits, but they're just audio. We don't actually use, very rarely do we actually use Zoom. If we have to, we'll do kind of like a FaceTime call with our phones. But otherwise, visits where patients exhibit symptoms of COVID, we're asking them to stay home, and we do telemedicine, basically just audio visits with them. So I'm doing maybe currently 0 to 2 a day, 0 to 3 a day, maybe of the, just the phone calls as opposed to an in-person visit. At the beginning of the pandemic, of course, I mean, it was so scary. And especially at the internal medicine office, at the quarterback's, office, we were expected to know what to do. And there really didn't seem to be a lot of, instruction from some of these big societies as to what we were supposed to do. So it was really interesting. All the internists, I feel like all the medical offices just did their own thing. And, who knew if you were doing the right thing? So, what our office did is we never closed our doors ever, but we asked, again, from the very beginning, patients that had any sort of sick symptoms, stay home, and we would do these telemedicine visits. So at the beginning, there was a lot of telemedicine. We pretty quickly procured the COVID antibody test for our patients. And then also pretty quickly after that, started doing the COVID testing. So, we kind of jumped on that, which was really helpful for our patients, especially as a primary care office. I mean, we were doing a drive-through, COVID testing clinic for a long time. And we've only stopped recently because of the demand has decreased, which is wonderful. And I think is hopefully speaking to the fact that the pandemic is crossing fingers, going away or at least getting better. So, yeah. So it's changed. I mean, right now at this second, I'm still kind of doing my same thing. I'm doing my annual preventative physicals, which of course, even, after a couple of months, people still said, you really still need to go in and get your preventative physical. So I've been wearing an N95 mask the whole time up until up until I got vaccinated. And now I've switched back to the surgical mask, which is dramatically
much more comfortable.
But other than that, I mean, I'm kind of still doing the same thing now.
Yeah, I mean, obviously, it's been a challenging time for medicine for everybody, but medicine needs to go on. And hopefully everybody is coming in and getting, because there is talk of, preventative medicine and detection and screenings going down. I mean, I can tell you, I don't do a lot of them, but my colleagues who do tonsillectomies, they say that, they're totally gone down precipitously because basically people aren't going to see their pediatricians.
Right.
And so hopefully things will get back, or the people who needed your care were coming in all along.
Right. Yeah, definitely.
Well, so, one of the questions I like to ask is, we all have great journeys. I've had great mentors and stuff. So I always ask people pretend you're at a Lifetime Achievement Award. And so who do you thank? Like, who are those people along your medical career who made the most? Because we all have, it's amazing how when I talk to people, they all have these mentors that were impactful. So who would those be and why?
It's a really good question. I mean, I would go back to that experience in middle school with my middle school nurse and my middle school science teacher. I was just actually speaking about my middle school science teacher the other day with a girlfriend of mine from high school. I mean, they were so impactful on my career choice. He was the best science teacher I ever had. My school nurse in middle school would pick me up and take me to the anatomy lab at the community college on a Saturday morning. I mean, these people just went above and beyond, to teach and to really kind of garner a love of science in their students in middle school. So, going back that far, I would definitely say those people were super impactful in my life. Let's see, more recently, I would say, let's see, in terms of, I mean, my mentors here since starting internal medicine, I really got lucky. I mean, Mort Dubnow, Bruce Bethencourt, Wayne Cool, these guys are pillars of internal medicine in Central Phoenix, at least in my kind of opinion. I mean, they've really shaped how I practice and how medicine should be practiced for me. I mean, these guys, all three of them practiced, between 40 and 50, well, maybe 30 and 50 years prior to me meeting them. And so they knew how medicine was before it all changed, before the corporations got involved, before the insurance companies ran how you practice medicine. And so Mort Dubnow showed me how to do a real, true annual physical where you had a 30-minute office visit to conduct a full, complete annual physical. He said, you definitely follow guidelines, but, just because the guidelines say, a woman over 65, for instance, doesn't need a pap smear, why not still do a pelvic exam? What does it hurt? Just do the full physical on every patient, get every patient undressed for every single exam. These are things that, these really, again, like these just pillars of medicine, in my opinion, of internal medicine kind of showed me. And I think I'm really lucky that I had that experience, because if I had just come out and gone into like a corporate medicine practice, like a lot of people are doing these days, I mean, that the way that they're teaching these new grads to practice medicine is we're going to lose it all. It's just going to be all imaging studies and referrals. So yeah, I think those were
Well, I think definitely people who have joy and show you joy really makes it, because it's a hard path, but it's a wonderful path.
Yeah.
Right. Well, this has been great. We've been talking to Tamara Lieberman. She is an internist at Arizona Internal Medicine. How can people get a hold of you?
Okay, so I'm sorry. I think my yard guys are here. I don't know if you can hear that outside. Okay, good. So Internal Medicine of Arizona is my practice. The website is topdocsaz.com. The phone number to the practice is 602-522-1900, and you're welcome to call and come and set up an appointment.
All right, Dr. Lieberman, thank you so much. This has been great.
Absolutely.
Thanks for tuning in to the Listen Up podcast. We'll see you again next time, and be sure to click subscribe to get updates on future episodes.